Dr. Ora Hirsch-Pescovitz. She's the president at Oakland University. You're not only the president of Oakland University, you're also a medical doctor. And, what is your take on all of this, just coming from being a medical doctor as well as a university president? You have information coming at you at all angles. What is your take on this?
Well, first of all, thank you so much for having me here today. I'm really delighted to be with you and with the audience here. Obviously, we're living in unprecedented times, and it is a challenge. We've been very fortunate in Michigan because after the big surge that we had in the spring, the population has really done a pretty good job of hunkering down, and I really credit our governor for her executive orders, and I credit our population for paying really close attention because compared to many other states over the summer, we've had a reasonably good response. But I do think that we have to pay very close attention now in the fall because there is a very significant risk of a second surge, especially now with flu season coming upon us. And so I think all of us are really concerned. And as a physician, and I happen to be a pediatrician, I'm a pediatric endocrinologist, I have a lot of concerns about what might await us now.
Yeah, how has your medical background played into the decision making that you have made with Oakland University? Because students are back on campus. As of yesterday, classes resumed?
Yes, yesterday was our very first day, and I would say that it has been helpful for me to have a medical background. At the same time, it's given me a healthy dose of concern and some anxiety. So it has been a good thing, but it has probably left me with some sleepless nights.
Yeah, so we've seen across college campuses, they've seen a spike after the kids have come back to school because we are talking about college kids. And so many policies and procedures are put into place to try to manage the virus on campus, but you can't take that off campus and how they live and they act. How concerned are you going into the fall season, and is there a possibility that Oakland University may have to go remote at some point in time if cases do spike?
Right. So first of all, we obviously prepare for all scenarios, and we are at Oakland University prepared for every possible outcome. I do have to say that we think that we're obviously very optimistic for the coming semester. And Oakland University, in some ways, is very much like many other universities. And in other ways, I think that we're a little bit different than many other campuses around the country and even around the state of Michigan. So I like to compare and contrast to some of those other universities, especially the ones that are struggling right now. And we are prepared, though, for every single outcome. So I could give you some of those comparisons if you're interested.
Absolutely, that would be great.
Yeah. So Oakland is a campus that has just under 20,000 students, a little over 19,000 students. So, but not all of our students are residential students. So if you're comparing, for example, you heard probably very recently that the University of North Carolina brought all of their students to their campus, and then shortly after that, they ended up changing their decision and sending them home. MSU made a similar decision not to have face-to-face instruction. And those two universities, big, large residential campuses where the majority of their students normally live on campus. And in the case of both of those universities, students come from many different places, and in many of those cases from out of state, but they live on campus and they're considered college towns. Oakland is different. the majority of our students are actually commuter students, and less than 20% of our students in most years actually live on campus. So most of the time we have less than 3,500 students that live on our campus. So that already makes us somewhat different than those large residential campuses. Secondly, in contrast to campuses like that, we're not considered a college town. You know, those kinds of universities, the majority of the community where the universities are located, they're college towns. That's what the community is about. It's about the college. And that's not really where Oakland resides. We're in both Rochester Hills and Auburn Hills, and we are integrated into our community. But the community is not just about Oakland University. We're a very important part of our community, but it's not just about Oakland University. And so we don't have a lot of bars and places where students congregate. And so that makes us pretty different. And I think that's another really big advantage for Oakland University in this pandemic. Another big difference is that most of our students, almost 100% of our students, are working students. And so they don't have a lot of time to party. And I think that is a really huge advantage for us as well. Now, at the same time, I told you I'm a pediatrician, and I know that college students are college students. And although we really all hope, all university presidents hope that students will comply with all of the regulations that we've put in front of them, and I'm happy to tell you a little bit more about what we have and expectations of our students, we know that college students will be college students. So we can't expect too much of them, but we do want them to know what is really required in order to keep them healthy and safe.
Dr. Ora Hirsch-Pescovitz with us on the Oakland County MegaCast. She is the president of Oakland University, our Facebook partner on today's edition of the show. So with all that being considered, and there's a lot to be considered on the students' end and on families' ends as they're bringing their students back to campus and back to learning at Oakland this fall. Has enrollment been affected by COVID-19 or positively or negatively or not at all?
Yeah, we're really, really fortunate at Oakland. Our summer enrollment was very, very strong and was above last year's enrollment and frankly exceeded our expectations. And so far, our fall enrollment is also very, very strong. And I have to say, has surpassed our original expectations and is just a tiny bit short of where we were last year. And I have to tell you that we had originally been predicting a drop in enrollment because of the COVID crisis, but it's looking quite strong right now.
Dr. Pescovitz, you have such an amazing background. Knowing your medical background, how did that play into your decision making to resume classes and even a limited capacity on campus as well?
Well, I would say that it probably caused me to want to be very strict with our rigorous program about reopening. And so I would say that because I have a healthy respect for this virus and because I follow the medical literature and the epidemiology about this global pandemic and what it's done to the world, and what it has done to our country, and I am fearful about it. It has made me want to put the safety and the health of our community front and center, even more important than the education of our students, because I know that we can't educate our students and keep their education ahead of them if they aren't safe and healthy. And also, I have a responsibility for the health and safety of our faculty and of our staff. And so being a physician, I think has been an advantage, but it, as I said, has given me a very healthy respect for this virus that knows no boundaries. It doesn't care whether you're wealthy or poor. It doesn't care whether you're black or white. It doesn't care whether you are an international student or a domestic student. And so we have very rigorous protocols for all of our faculty, staff, and students. And I think it's because I am fearful of what a pandemic can do and what a surge in this virus could do to decimate our plans for the fall.
The program there on campus, Grizzlies Protect Grizzlies Healthy Together, you requested the students take an honor pledge and that they will wear their face-to-face coverings. They'll practice good hygiene and safe social distancing. Is there any type of repercussions for students who don't follow some of the rules that you and the administration has laid out to try to keep everyone safe there on campus?
Yes, first of all, let me just emphasize that program is not just for students. We expect faculty and staff to follow the exact same regulations that we expect from students. And it sounds like you've read that plan, and I'm delighted that you have, but it isn't just for students. Our approach basically is that we would much rather have carrots than sticks. And so our emphasis is on educational campaigns and on communication rather than on punitive measures. And so we have spent a lot of time communicating that program. And we have student ambassadors, and we're spending an enormous amount of time trying to reward people for following the plan. So we have lots and lots of, we have competitions for people who come up with the best masks and the best enforcement programs. But if people do not comply with the programs voluntarily, we have enforcement measures that range from simple reminders, which is our preference, all the way to if there are repetitive reminders that do not work, all the way to the possibility of suspension. And the reason for that, and again, it goes back, I guess, to your earlier question about my medical background. The reason for that is that in contrast to some other times where somebody might not comply with a rule that we might have on campus, is that if you don't comply with the regulations here, you're not just hurting yourself, but you run the risk of potentially creating a situation where a surge of the COVID infection could actually adversely impact our entire campus. And you could potentially put someone at risk for this virus who is much more vulnerable than you. And therefore, you could potentially expose someone who is immunosuppressed, or they might take it home to someone who is immunosuppressed, and someone else might die. And potentially, our entire campus would have to close down as a result of someone not complying with our rules and regulations. And so that's the reason why we have to have such very strict enforcement of our rules and policies. And so it isn't just a simple matter of one person not following these rules and regulations, or wearing a mask, washing their hands, social distancing. It's because it has these implications for our entire community, and we're part of a very large family. And this is a very unusual circumstance that we've never faced before.
That's certainly good to hear, and an approach to enforcement that I'm sure the student body will feel much more comfortable about than necessarily an emphasis on enforcement only. Earlier on this week, Dr. Hirsch-Pescovitz we talked to the student body president, Ethan Bradley, who had expressed some concerns from the student body regarding enforcement of these guidelines because there's so many people, the majority of the people that are students at Oakland University are people that are commuting to the university. For those that live on campus or those students that may feel uncomfortable in a situation or feel like certain enforcement is not being done, how can they best express those concerns to the university, knowing that the university, of course, is taking that very seriously?
Yes, well, by the way, our student leaders have been exceptional. Students like Ethan, who have really taken a major lead in communicating to their fellow students, because I have to say that it's probably one thing for students to hear from administrators like myself about how important it is. But when students hear from other students how much they want their fellow students to comply with regulations like this because it matters to them, they do a much better job of communicating these messages. But if students hear that other students are not complying, they really do need to let, for example, in the residence halls for RAs to be informed, and then it will rise up progressively and we will take appropriate actions. And the same thing is true in the classroom to notify instructors, and we will take appropriate actions. You know, I know that many students, there's a lot of this out now in university press about whether students feel comfortable, for example, tattling on other students. And I certainly understand I told you I'm a pediatrician, I'm also a mother and a grandmother, and I understand how challenging that is for students to do that. And I'm not necessarily advocating for that. I don't know that students necessarily need to do that. The best thing for them to do is to tell one another, not to necessarily tattle to the administration. And if it's easier for them to just tell one another that they're uncomfortable, that they're putting one another at risk, I think that works a lot better than raising it to a higher level. So they have a choice in how they want to approach it. They can either tell someone at a higher level or they can tell each other, but they certainly should not settle for a situation in which they feel uncomfortable.
Doctor, I know that you have a very tight schedule today. You're extremely busy, so we appreciate you taking the time out of your schedule to speak with us. But quickly before we go, any last thing we didn't ask that you do want the people of the public to know?
Well, I do want them to know that at Oakland, we're doing everything in our power to create the safest and healthiest environment we can. But we also recognize that there are some circumstances that may be out of our control. And one of the things that I am very proud of is that we've offered choice. So for students and faculty and staff that feel more comfortable staying at home, we've attempted to make that option available. So we have hybrid and programs that enable them to take remote learning. And the same is true for those that hope to be face-to-face. So we've tried to make our programs as flexible and as adaptable for all circumstances as much as is possible, given the complexities of these unprecedented circumstances that we're living in.
Doctor, thank you so much for your time. Stay safe, stay healthy, and we all appreciate your leadership, even members of the community.